Ecosur's Trachoma research team presents Trachoma in Chiapas, the Forgotten Disease. Located in the southeast of Mexico, Chiapas is one of the Mexican states with a rich cultural heritage and magnificent natural resources, but also one of the least developed and most marginalized states of Mexico, with the worst social and health indicators in the country. In geographical area between 280 and 2,900 meters above the sea level, it is located in the highlands region of Chiapas. This region is characterized by its mountainous geography, rainforests, and mild weather. In its rural communities, several indigenous Mayan peoples, among which Setales and Tzotziles, stand out for their numbers of speakers coexist. The highlands region, in terms of educational services, housing and health conditions, is considered to be one of the most marginalized of the country. For example, the illiteracy rate is over 30%. Almost 60% of the households lack water supply and have dirt floors. 1 out of 10 households still lacks electricity, and 70% of its inhabitants live in overcrowded conditions. All of these conditions have led to high rates of childhood malnutrition, maternal mortality, and infectious diseases such as trachoma, which affects mainly the population of the municipalities of Chenal, Huixtan, Ochuc, San Juan Cancuk, and Tenajapa.
Meliju okun bayalte oletik lashano techuga biju ba abe ametsit honos les sakona water lot oletik che khabila pasa puro okan
pero ya nate bistuk sakotik te shamesiti ka
ma natik bi
ma nate
ma na
bistuk
honos metela sak ubkate site kutile qaibuk na kutile la qabeshalti iche mulu chelati iche bu sonos mejay.
Trachoma is the second cause of blindness in the world. Trachoma is caused by a bacterium called Chlamydia trachomatis, which is transmitted from one person to another through direct contact or shared cloths contaminated with ocular and nasal secretions from a sick person. Although it can affect persons of any age and sex, mothers and children are the most vulnerable to trachoma infections. A person can suffer repeated infections of this disease several times in their lifetime. The most common symptoms are ocular burning, watering, and intolerance to light.
Yeah, mas ayang kun doktor, mas ayang kun. I want bent anyone skaltik bela. Hiche khos ebe melma chop is at the way, yeah. Ni ayuga chop mel tayala. Asa tsilat pihe tsila ma bat chebal tsila ora. Ta pihe Yana wayel mak asyayel hich bit wayel mer supet. Ay kapal ayala tahsitika hichana chasok tawaya.
Repeated infections from Chlamydia trachomatis causes scarring in the tarsal conjunctiva, the inner part of the upper eyelid. Eyelid scarring provokes deformity of the upper eyelid, which causes that the eyelashes get turned inwards, rubbing and damaging the eyeball, causing scarring of the cornea. This condition impairs vision and eventually blindness, which is most common in people over 30 years old. The first cases of trachoma in the region were reported in the 60s by the Mexican ophthalmologist Toro Ella. In 1985, Taylor and Millen carried out a study in 2 communities of the municipality of Ochuc and reported that 25% of the under 15-year-old population had active trachoma, and 100% of the population over 40 years of age showed trachomatis scarring. It was not until then that the health authorities declared trachoma as a public health problem in Chiapas endemic area. 13 years later, from 1998 to 2001, Ochoa and collaborators of Ecosur studied 21 communities of the endemic zone, finding a global prevalence of trachoma of around 10% and a little less than 2% for active trachoma. In that study, for the first time in this region, molecular tests, PCR, were made to identify the bacterium Chlamydia trachomatis and its genivars circulating in Chiapas. According to the information generated by the detection activities undertaken by the public health institutions in recent years, a decrease in the prevalence of trachoma in all its forms has been observed. In 2007, the local health authorities reported a global prevalence of almost 2%, and for the active conditions of the disease, much less than 1%. For more than 10 years, a research team from Ecosur, conducted by Dr. Héctor Ochoa, has made efforts to contribute to the knowledge and control of this disease through research, training, and associated activities. Since 2007, this team has undertaken a research project to determine the magnitude and distribution of this disease, and using this information to support the design of better programs and actions to fight it.
El propósito de la investigación es evaluar el estado epidemiológico y bacteriológico del tracoma en el área endémica de esta enfermedad en el estado de Chiapas. Esto con el fin de generar información y conocimiento científico para mejorar los programas de atención y de control del tracoma en el estado.
A cross-sectional household survey was designed in order to obtain information about the frequency of trachoma in the different groups of the populations and the factors associated with this disease. The study sample included 50 rural and urban communities, of which 20 of them had already been studied previously from 1998 to 2001, and 30 new communities selected from the rest of the communities of the 5 municipalities of the endemic area. In most of the communities, clusters of 20 households were studied, and in the biggest communities, from 40 to 60 households were studied. All the households were selected at random. In order to obtain the necessary permission to undertake the study, the researchers visited in advance each of the selected communities to explain to the authorities and inhabitants of the communities the activities that would be carried out. When the research team arrived in the communities, the households were selected at random. With the help of the authorities of the communities, the research team elaborated a sketch to locate the selected households. During the visit to the households, the members of the family were interviewed, visual examinations for visual acuity measurement were performed on all persons older than 6, and all the family members had ocular inspection for trachoma signs and other ocular diseases. The WHO simplified grading scheme was used to classify clinical signs of trachoma. In all the children under 10 years old, in which signs of active trachoma was detected in a relative of the same age living in the same household, were chosen randomly. A sample of the tarsal conjunctiva was taken to detect through laboratory test the infection from Chlamydia trachomatis. To all persons detected with trachoma and to their family members, we provide the indicated antibiotic treatment, oral azithromycin. They have also treated those people who were suffering from other ocular problems, and in the required cases, they were referred to the local public health facilities for treatment. To undertake these activities, a group of community health workers from the region and speakers of local languages were selected, contracted, and trained in primary ophthalmology and the needed skills for the fieldwork activities. The fieldwork lasted 5 months. During this time, a total of 1,218 families from 50 communities of 5 municipalities were visited and interviewed. The researchers also made ocular examinations to 6,542 people and visual acuity tests to 5,042 people. In total, the researchers found that over 3% of the study sample presented some clinical signs of the disease. Among the children under 10 years old, the active inflammatory form of trachoma was found in prevalence of almost 1.5%. This means that 15 children out of 1,000 children are needing medical attention. As regards to trachomatis trichiasis, among the participants 30 years old and over, the prevalence was higher than 1%. However, when we look only to the women among the same age group, the frequency of trachomatis trichiasis is almost the double, which reflects the need of surgery of the eyelids in order to prevent blindness. Regarding corneal opacity, the researcher found that 9 per 1,000 inhabitants were at this advanced phase of the disease, which indicates the burden of blindness and visual impairment due to trachoma and the failure of the health services to prevent people affected by blindness. Comparing these results with the ones obtained in the previous research, undertaken by the same research team 10 years ago, they found that the morbidity rates for trachoma has declined during the last 10 years. Nevertheless, it is important to emphasize that these results show higher frequencies than the official ones, and that the indicators proposed by the World Health Organization. Therefore, it is not yet possible to speak about the control of the disease and much less of the elimination of trachoma in Chiapas. Through the laboratory tests, the researchers identified chlamydia trachomatis in 15% of the persons from whom a conjunctive sample was taken, and the circulating genovirus in the endemic region were identified. To inform about this disease, its magnitude, and distribution, we undertake community workshops at the municipalities and communities. Through these workshops, we inform and analyze with the participants the clinical, epidemiological, and laboratory results. With the opinion and comments of everybody who participates in the workshops, we make proposals for the control of this public health problem.
Ma yo khonas iskoto khak ta doktorlita pontelo kaltega maskashie ma bisi ya que es caso dicta San Cristóbal o ta Tuxtla ta yala la hastik o 6 milyon 10 milyon ta yala ha hiç yalvun zebe be bana talak olan ba.
Our results show that trachoma in Chiapas is decreasing, which represents a unique opportunity to implement effective interventions to control and eliminate this disease in Chiapas. However, it is still a public health problem in the most marginalized communities in the Highlands region, whose population is lacking in environmental services, clean water, and good quality healthcare services. All these factors contribute to that the bacterium that causes trachoma keeps transmitting and causing new cases of the disease. For this reason, a collaboration is necessary among the governmental institutions, NGO, and the communities to implement effective programs aimed at the primary prevention of the infection by trachoma and providing surgical and medical treatment to those who already suffer from the active or chronic phase of the disease. Strategies like the one proposed by the World Health Organization called SAFE, which stands for S for surgery to persons with trachomatis trichiasis, A for oral antibiotics to treat the active cases, F for promotion of facial cleanliness, E for environmental improvements of the households to reduce transmission of chlamydia trachomatis.
Ay işte 22 años me 20 años ya te quieren a colina a veces nave le bay tenen bay lumante bay commente calde le las manos que la doctora te culbe ma yok be gana ya te la jilbuna sulbun de sitte şa kulle la jilbun kulle hiç şa kulle hiç hadi de açın tağı işi şu tikalde çin tağı bas mulbun çalsın da sitte as bot belgal da nuglele hadi de imite hiç sevel lugar la bata baş itel de sızala hada medlek ate sitte gelde ki pero ame mazate ame de sitte pero batla hamelle bet trachoma pero madalla le kuble la bulu bisita lela ejo hamma kan yunis jambal tabat be ha handa malle tu sisha bisha ute kilkinala
It is important to improve the quality of surgical services being provided to patients with trachoma trichiasis. With good quality post-surgery care and counseling to patients, it may be possible to reduce relapses and increase patient satisfaction and acceptance of surgery. The results of this research are an important starting point to improve and support the design and implementation of strategies that focus on health promotion and prevention, based fundamentally on social participation, as well as to assure the efficiency and sustainability by means of interinstitutional and intersectoral cooperation. To this end, a social network to combat trachoma was created. This social network was created by governmental, academic, and civil society institutions in order to undertake coordinated actions and programs to contribute to the control and elimination of trachoma in Chiapas. Ecosur forms part of this network. It is necessary not only to offer selective medical actions, such as SAFE, but also offer comprehensive alternatives to improve the living conditions, the water and sanitation infrastructure, and to apply new ways of seeing and attending the health problems from the own community's perspective.
Hiç mi porque inesbab de hiçka te a clínica leto ayo inskoplamar kaldı gel ay bana ayo ambulans estas estado bem chamal ama chamero grave ainda chamele estal ambulans jikutik bel mashune to mashune jikutik beta hospital ta bante ta hopel o jurisdicción kalti jikutik bel de hiçu pero como mai tem ha hale bukula mata mai gela mata ha mata ha ya mel kodan yo mel te manish hiç bir kaldı gale mesela madem botik gel hiç bir kaldı to teme botik abe chamay abe turante chamele o balabe o koşu dilame bana şkoti mesela jal doktor ho mai pasti mai te poşe meşe abe yana mel kodan dinambe be surite chalabe be que está pasti pues tiene que budishan o abe mas chom posle to hay mantık sene gabe be taç intagen dige iş okul dige şabe sene gabe hay tiene que le forma de bir kuç yaş kaşel te chamele be.
Trachoma as a disease that mainly affects the most isolated rural indigenous communities, and because it has not been reflected in the mortality statistics, has not received the needed support and resources.
Chiapas.